Cranial nerve 10, the vagus nerve. Vagus is the Latin word for wanderer, and also where we get the word vagabond. This is because the vagus nerve wanders throughout the body. The vagus nerve innervates visceral sensory from your throat, vocal cords, your thoracic and abdominal regions, as well as somatic sensory to the external auditory meatus and the skin above and behind the ear, as well as the diaphragm muscle, a sense of taste from the root of the tongue and the taste buds at the epiglottis, which there aren't too many of, as well as motor and proprioception to the above mentioned regions in the throat and larynx, and most importantly, probably a parasympathetic innervation to the thoracic and abdominal organs. Let's look at the pathway vagus nerve takes. The vagus nerve arises in the medulla oblongata as a pair of nerves. They emerge from the skull at the jugular foramen with the cranial roots of hypoglossal and accessory nerves. Both the left and right vagus branch off into the meningeal and auricular branches on each side of the head. Each vagus nerve leaves the cranium in the carotid sheath, but from there they take slightly different pathways. The right vagus branches into the superior, internal, and external laryngeal nerves, the right recurrent laryngeal nerve, and the pharyngeal nerves. The left vagus branches into the left recurrent pharyngeal nerve, before contributing to the pulmonary and cardiac plexuses with the right vagus nerve. Then, at the esophageal plexus, both the right and left vagus nerves rejoin each other and go on to supply innervation to the rest of the organs of the abdominal cavity, forming the gastric, pancreatic, gallbladder, and intestinal branches. Vagus nerve dysfunction. Symptoms of vagus nerve dysfunction vary based on where the issue is and what is causing it. A tumor impacting an autonomic branch to the stomach could impact digestion, for example. But a deep laceration from a motor vehicle accident would probably not impact digestion, but may impact swallowing. Although we are unable to test some aspects of the autonomic nervous system in a massage therapy clinic, there are some ways we can examine the client for vagus nerve dysfunction. One being monitoring the client's heart rate and blood pressure. We can also test the sensory portion of the auricular branch of the vagus nerve. We can observe the client's speech, and we can also do an oral examination and swallowing test. The next thing we're going to do is take Cameron's blood pressure and heart rate. And then you'll want to take your client's heart rate. Then get your client to squat down on the floor and keep them there for about a minute. Then get them to stand up rapidly and retake their vital signs. You want to know if there is difference in between the measurements. If the body can't bring the homeostasis of the heart and the blood pressure after a postural change, this could indicate issues with the autonomic nervous system. You can do a sensory test for the auricular branch of the vagus nerve. And you can do this by just sweeping the external portion of the ear canal. So you don't have to actually go right in. It's just right there in this pink space that you can see on the diagram. When you observe the mouth of your client, take note to see if their uvula is deviated to one side or another, or if their soft palate is drooping. You also want to make note to see if their voice sounds like laryngitis. That can also indicate a paralysis of the vocal cords. Also observe if your client is having any difficulty swallowing, as the vagus also innervates the throat muscles, and this could indicate issues with the pharyngeal branch. The vagus nerve is crucial to the proper functioning of the autonomic nervous system because of its vast innervation through our vital organs, playing an important part in regulating digestion, heart rate, blood pressure, bronchial dilation, and more. You can get an insight into the health of the vagus nerve by testing for abnormal changes in blood pressure and heart rate, observing speech, swallowing, and touch sensitivity of the ear.